Welcome to All Things Chiropractic.
Welcome to All Things Chiropractic. I'm Paul Andrews.
I'm Dr. Mark Davini.
Okay, we're going to tiptoe into this one today.
I call it a call to arms.
Arms as in weaponry or?
As in arm.
Oh.
And what we mean by that is, how has COVID and the vaccines changed chiropractic?
Okay.
Ouch.
This can be a very sensitive topic to some people.
Absolutely.
You know?
Yeah.
So,
and it's a serious one.
It is.
Today. And what are we talking about?
So let me ask you a question that will lead us into answering the one you just asked, which is, do you think since COVID and the vaccines that there's been a change in how chiropractors should approach their care?
Absolutely.
What?
And unfortunately, the change isn't because of anything we do or why we do it or how we do it. It's the change in the patient population that's out there. So patients right now are different. And it's directly a result of COVID and the vaccines. There is a predisposing factor now that didn't exist before the two of them existed. So, and without getting into the discussion about whether it's, the vaccine is good or bad, or getting into the discussion about whether or not COVID was natural or not, it's irrelevant.
Right.
They were here and they have made a change. They've made a change in patients' physiology, and that change in their physiology now impacts what and how we do. And unfortunately, again, nothing to do with what and how we do what we do, but it's all about perception.
So when you make these statements, where's the data? Like, what are we talking about real time as far as variables or changes?
So let's just dump it on the doorstep of a basic change in what the COVID virus and the vaccines have done. And there's tons of studies out there. All you have to do is just type in COVID and vaccine, COVID and this and COVID and that. So there's tons of studies, but the summary of it is very simple. They have caused a change in our vascular systems. They make clotting easier to some people. They make, these DVTs more common. They have heart issues. There's a lot of different things. But one of the primary things that they do, and it's not up for debate, this isn't an opinion, this is just what's out there, is that it causes vasculitis. All of a sudden, your blood vessels are more inflamed, makes them more fragile, makes everything about the way your vascular system works. The studies show that there can be a short-term effect, there may be a long-term effect, there may be a forever effect. Who knows? That's going to be ongoing because this isn't old enough to be able to answer any of those questions. But accept the fact that COVID and the vaccines have changed the way our blood vessels, the stability of our blood vessels. Couple that with the fact that we have a population that pretty much takes a ton of drugs on a regular basis now. I mean, and have had, what was it? They said before 1986, there was maybe 12 or 15 vaccines that somebody had in their lifetime, and now it's up to like 77. So our bodies are dealing with drugs. They're dealing with drug interactions that can't possibly be investigated because there's just too many of them to account for all the permutations of these drugs with each other. And then we throw in something like COVID and the mRNA vaccines that deposit these spike proteins in our blood vessels that, again, not my opinion, this is fact, and it deposits these spike proteins in our blood vessels that have an effect on the stability of those blood vessels.
So I think it's fair to say that no matter what you put in your system, your body has to handle it, assimilate it, metabolize it, whatever it may be.
True.
And I think the statistic is that the average American's on 7 different drugs. If you're on a drug, you're on up to 7. Like it's nuts. And sometimes the majority of them are just to counter side effects of the primary drug that you need.
Which is most of the time. I had a relative that was on high blood pressure medication and developed a DVT. So now you have a DVT and she's on high blood pressure medication. So they give her Eliquis. Don't even get me going on Eliquis. But they give her Eliquis, which is a blood thinner and an anticoagulant. So by virtue of the fact that it's a blood thinner, it would, as an effect of the drug, lower blood pressure.
Right.
So now you've got one drug lowering blood pressure from one way, and then she's on this other drug that lowers blood pressure. Her blood pressure was tanking. And the medical profession never bothered to talk to her about the interaction between the two drugs she was on. They only talked to her about what the side effects, and I don't call them side effects, I call them the effects of Eliquis. So
there's a tangent. We probably shouldn't go down too far, but the tangent that I'm bringing up is that the pharmaceutical management in medicine doesn't happen from one person.
No.
Right?
No.
Because the PCP...
3 specialists involved in this person.
And they all want to stay in their lane and not step on toes.
Yeah.
Meanwhile, you're on a multiple amounts of drugs that have these interactions. And it's really going to be the pharmacist who's your first line of defense.
The only one that really knows about drugs is truly the pharmacist. Your medical practitioner only knows what the rep tells them.
Or the AI agent now, because they're the ones handling. They're the ones managing it. But
and they've segmented themselves out so specifically that this is my left eye doctor, this is my right eye doctor. I mean, that's a joke, kind of. You know, they've segmented themselves so much that the left hand truly does not know what the right hand's doing.
So when we bring this back, let's bring it back to the start, medical history. Now, when we talk about a chiropractor taking a medical history, right?
COVID, vaccines,
not
boosters.
Just
when was the last booster they had? What are we talking about here, Paul? I know we've kind of danced around it a little bit, so let's just put it right out there. We are talking about a compromised vascular system. And unfortunately, one of the things that gets attributed to the chiropractic adjustment, which has no foundation in research at all, is vertebral artery dissections. I said it. VAD, they're out there.
Wow. A bold statement, but I have to say, you'd be the first one to tell me that you've seen an uptick in malpractices in this
It's
area.
A tremendous uptick in the, we'll say, the event that of a VAD or similar type of events are happening. Now, in the past, when one of these things did happen, it was always, truthfully, never the result of a chiropractic adjustment. In fact, research has shown that the adjustment does not cause these things. But what does happen is a temporal relationship. Somebody comes into your office and in and around the adjustment, they have a VAD. So one of two things happen. They come into your office with it, which is truly what research has shown happens most of the time. They come into your office with the VAD and you fail to recognize it. And that's not to say you couldn't make situations worse if you didn't recognize that a VAD was already in place. And sometimes it's recognizable. Sometimes it actually isn't recognizable. So, but they come into your office and they have it. And then it gets worse and they go to the emergency room. What's one of the first questions they ask now in the emergency departments?
What's your insurance?
Yeah, that's number one. Yeah. Before they get to number two.
Yeah.
But if it has anything to do with a vascular appearing event, have you seen a chiropractor?
Oh, do they ask about that?
Oh, yeah. It's like in transcripts I read all the time now when it comes to these cases. And in the past, you know, if they said, oh, I saw a chiropractor this morning, they might try and make a temporal relationship. But now they're actually making a temporal relationship days. And I saw one 2.5 weeks later, they're still trying to say, oh, you saw a chiropractor 2.5 weeks later. That's why this is happening.
Do they ask if it was the ring dinger? Because I don't know.
I don't know. You know?
That one's pretty hard.
Yeah. But it's real, is what I'm saying, that before they were few and far between. But since COVID, the occurrence of vascular events has increased dramatically, which means that these people are going to chiropractors and it's happening more often in and around adjustments, not necessarily from adjustments, but in and around adjustments. So COVID has changed the landscape in that when this happens, and now that it's happening more and more and more, and it happens in and around adjustments, they're going to blame you. Now, it doesn't matter that, there's a higher incident of people going to their Pilates class and having VADs, or to their hairdressers bending their neck over those porcelain sinks having VADs. And we don't have to worry about them signing informed consents when you go to your yoga class. Okay.
Mhm.
But yet for some reason, they think we are the major precipitating event of these types of presentations to the patients. So it was so few and far between before, but now it's common. And as you know, as part of our Tools of Practice program, we call our clients every month. And I don't go 2 months without hearing of an event. Where before, I would go years, 4, 5, 6 years. I do a lot of malpractice defense, and I have more cases that have occurred since COVID than I had prior to COVID collectively.
Do you think, in general, I'm going to ask, do you think that the average chiropractor does enough subjectively or objectively to help hone this possibility of a VAD issue either occurring or have occurred?
Well, you nailed it right there.
Did I?
You nailed it right there.
Oh, wow.
So it's interesting, because now even some malpractice carriers are recognizing the added risk of COVID and COVID vaccines to having a vascular event. Okay. So let's just back up a little bit. Chiropractors are their own worst enemy sometimes when it comes to this. And what do I mean by that? Ask your chiropractor friend if they take vitals on every exam.
Please.
Every exam.
Started.
Not the first exam, and then I treat them for 20 years.
Right.
Every exam you do, you take vitals. And I literally get people say to me, why would I do that? And my answer would be very simple. Of the 4 main reasons why someone comes to see a chiropractor, headache, neck pain, mid-back pain, and low back pain, all 4 of them have vascular alternatives.
Right.
Why would you fail to take vitals? So before, when VADs were so rare and aneurysms were so rare that you might practice your whole life and never see one or experience one or even hear of one. But what we're saying now with COVID is there's a good chance this could happen. So you have to take on the responsibility of recognizing that it may be there when they walk in, and you have to do due diligence. You have to maintain standard of care, everything you can do to try and determine if they walked in with it. So if I have a headache, subluxation is probably the reason why you have a headache 99.9% of the time in the old days, pre-COVID. Post-COVID, not so much. They could have headaches for other reasons. They could be having an ischemic stroke or hemorrhagic stroke. They could be having a VAD. Do you know, and I'm saying this rhetorically, but you may answer the question, but do you know what the 2 main presentations of a VAD are?
I can guess headache's probably one of them.
Headaches, like they've never had before. And what's the other one? One-sided neck pain.
Neck pain, huh?
One-sided neck. So how many people out there have patients come in there that have headaches and one-sided neck pain?
But let me ask you the question, though, because COVID and vaccines is only about 5 years old-ish.
Mm-hmm.
Are chiropractors trained for this?
Absolutely. And for some reason or other, I don't know, they get knocked in the head or something, but they decide they don't want to pay attention to this anymore. Okay.
To use my ignorance, but I mean, you've been out of school a long time. You didn't have COVID issues, but are the assessments of a chiropractor in their training different
I will
now?
say that in 1981, one of my instructors was Phil George of George's Test. So that's when it first came out as an issue that we as chiropractors had to pay attention to, was 1981. And now here we fast forward and go, okay, they're few and they're far between, and the likelihood of one happening from a chiropractic in conjunction with a chiropractic adjustment was 1 in 2 million. Okay, so we're way outside this.
That's like 54 years ago, right?
And that's the current stat today is 1 in 2.
But saying like That was like 54 years ago.
Yeah.
I just did the math.
Yeah.
Wow.
So this is not a new topic.
I'm not saying anything about you, Doc, but.
No, but you just did.
Yeah.
But I'm saying this is not a new topic. This is an old topic that is now resurfacing. We're giving fodder to the medical profession as far as criticizing us because they're going to use us as the scapegoat for something they've done. They gave us COVID. They gave us the COVID vaccines. They've increased the incidence of VADs, and they're going to blame us for it if we don't do what I was taught to do in 1981, which means everybody after me has been taught to do this. Now, we know that Georgia's test has been debunked here and there and everywhere, but there is a standard of care. And let's talk about that just quickly. Do what you're supposed to do. And if something happens, it's not your fault. It just, crap happens. Crap happens all the time.
Well, we see that in medicine a lot, right? You're signing these robust, informed consents that include things that should have been known or things that were unknown.
Absolutely.
Right? So somebody has an adverse reaction up to including death, but if that care was done in a standard way.
So a patient comes in and they have a headache and unilateral neck pain. Severe headache. The description is always like the worst I've ever had in my life. So they have a headache, severe headache and neck pain. And you don't take vitals. Is that standard of care being maintained? No. Do you do anything to investigate whether or not that headache and neck pain is of vascular origin as opposed to mechanical nature or subluxation?
Well, now I think you've nailed something here, because if you're a chiropractor and all you're looking for is subluxation and not alternatives to their symptoms, right?
Mm-hmm.
Are you doing your job?
No.
That's the hard part, I think, is because like you go to a surgeon, they want to cut, right? So
everything needs surgery.
Right. Yeah, exactly. Right. You go to a GP, everything needs prescription. I don't know. Right. So you go to a chiropractor, like you go to a physical therapist, everything needs therapeutic exercise, right?
Oh, absolutely. And I know if you listen to our podcast, you've heard me say this a gazillion times. The good news is we're not quacks anymore. The bad news is we're not quacks anymore, which means when I started practice, medicine did my screening for me.
Right.
Now that we're accepted more, people come to us first. We have to do our own screenings. So when you look at the risks of VAD from just a history perspective, arteriosclerosis, diabetes, infections, genetic causes. I mean, you can have a lot of different reasons why you have vascular issues or potential vascular issues. And then they come in and they have the two most common presenting symptoms, severe headache and unilateral neck pain. And so now the history should have been taken. You should have at least an understanding that there's a possibility, the red flag mentality, right? There's a possibility. And then you do the best you can to examine the patient to rule out any vascular concerns. And God forbid something does happen. It's not because you didn't adhere to standard of care, which most malpractice cases first have to prove a deviation from standard of care. If the outcome's not what you wanted, it doesn't matter. You will win that case because you maintain the standard of care. But if you ignore the standard of care, if you deviate from the standard of care and something happens with that patient and it really didn't have anything to do with you, doesn't mean you're not going to get blamed or the case wouldn't be lost because of it. Not every case the malpractice case that's lost is because the doctor did something wrong. It's because the jury perceived the doctor did something.
Well, and let's not lose the overlay of the human perspective. You've got a person in front of you. Wouldn't you want that person to get the care they need if their life is in jeopardy or their quality of life is in jeopardy because you failed to help assess something that isn't in your scope, let's say?
All the we'll say the VAD cases and stroke cases that I've defended, the hardest part of it is that the doctor feels guilty. Because they have this sense that maybe they should have or could have done something different. And unfortunately, in a lot of cases, it is true. They could have, but they still didn't cause it. So it's like, doc, recognize you didn't do it. But now we have to make the perception be to the jury that you didn't do it. So it's a very easy case when you do what you're supposed to do, and you do it in a way that no other doctor would have discovered that patient walked into your office with a VAD. Sometimes you will discover that they do. Simple auscultation of the vertebral arteries might tell you that there's a bruit there. Do bruits happen all the time with VADs? No. But if you have one, you might go, ooh, red flag. You understand that the studies prove that it really can't even happen in a carotid artery. Literally, they've done the studies and said that going through normal range of motion puts more of a stress on the carotid artery than an adjustment. But the idea that you did something to support that thinking, maintain the standard of care, and then if something happens, unfortunately, you won't be held responsible because no other doctor could have been held responsible. Do you know that the incident rate of VADs going to a medical doctor is almost exactly the same as going to a chiropractor?
That's interesting.
Isn't that interesting? So you go, wait a minute. So what's the difference between what we do and they do? Well, we do the adjustment, they don't. So the adjustment can't be the reason why VADs happen. What they say is that there's a natural screening process that takes place. I have a headache. I have neck pain. I'm going to go to a doctor. Well, in the old days, the first doctor they went to was the MD, and they did the ruling out for us. Today, they come to us first.
Right.
We have to make sure that headache and that neck pain comes from a subluxation. I'm a chiropractor because of headaches. That's what made me go to a headache. I mean, go to a chiropractor. Okay. So, this is my life's blood, is that chiropractic has kept me in my pain-free state since 1978.
Wow. I'm not going to do the math on that, but so to clarify though, you got a patient or a new patient walk in, they've had COVID 5 times. They've had, 8 boosters. You're not saying don't treat them.
No. In fact, they probably need it more than anybody, but you might, if you do your due diligence and in your mind, you've done all you could to make sure there wasn't a VAD. And there's not much. We'll talk about that in a minute, but there's not much. Truly, there's no standard test that tells you anything for sure, but you maintain the standard of care and you treat them. And maybe you might say, I'll start out treating them conservatively one way or the other. But the bottom line here is you do what you're supposed to do, as far as screening them, and then you do what you're supposed to do as far as treating them. And 99% of the time it'll work out the way it's always worked out in the past, that these things don't happen, and they don't happen because of what we do. There's a 1 in 1,200 chance that you'll die from taking aspirin every day or any NSAID, from taking any NSAID every day for 3 months. 1 in 1,200. Yet we don't have to have informed consent on your bare aspirin bottle, right? But for some reason, we got to tell everybody. I look at some of these informed consents and I read them and go, well, I wouldn't sign that the way that's worded.
Right.
Yeah, it's like,
nobody's reading them, though.
Nobody's reading them anyway. But we do have to have consent from the patient. We do have to make them understand that these things happen in and around an adjustment, not from, but in and around an adjustment. So it's a whole process that we talk about as far as bringing a patient in. And if you're not doing, a proper history, if you're not doing a good exam, if you're not doing a report of findings to include informed consent, if you're not modifying your treatment based on the previous things I just said, then you're not following standard of care.
I think it's pretty telling that you have one of the major malpractice carriers now coming out with some proclamations and or guidance on this too, because that's an acknowledgement beyond just an opinion you or I may have one way or the other. This is based on, like all insurance companies, it's based on their data.
Exactly. And they don't say anything unless it means that there's a problem for them, which means they are seeing the increase in complaints. And that means they're defending more cases. So, if you look at what their recommendations are for what you do, it's exactly what I said. Unfortunately, there is no specific test. Like I say, George's test was debunked many years ago, but that doesn't mean that you do what you can. Personally, I went through and I always did George's test. Like I said, he was one of my instructors. I always auscultated.
I'm not laughing for any reason at all.
The vertebral arteries. But George was from Massachusetts. And I did what I was supposed to do so that at least I had a defensible position that it was not a detectable VAD. Not to say that I haven't caught VADs, but I'm saying every now and then there is one that's not detectable. And if something happens, you're not responsible.
Yeah, but Doc, I did do it. I just didn't write it down.
Yeah, right.
Until after I got the letter in the mail. Then I wrote it down.
Oh, let's go back to our malpractice podcast, right? Exactly. Yeah, that's what I mean. It's time to put on the big boy pants and the big girl pants, and basically accept the fact that patients have to, when they come in, you have to do a real history. You have to do a real exam. You have to do a real report of findings, and your treatment has to be based on those previous three. And if you're not following that formula, you're not following standard of care. If you're not following standard of care and something happens, whether you did it or not, it's on you.
And don't slack on the re-exam, as you had said, on testing these things. Or if you have a history that might lead you to this, but your objective findings originally didn't lead to anything that you thought were flags, but now you're treating them, maybe it's good to, check these things again.
Yeah, absolutely. The re-exams and vitals in the re-exams, things like that. These are not events that happen that often, but they're now happening to such a degree that it wouldn't be unreasonable to expect that someone's going to come into your office with a VAD. Like I say, when you think about all the things that we do in the course of our activities of daily living, like I say, yoga, Pilates, hairdressers,
massage.
There was actually a study I read that some of these studies equate massage and chiropractic in the same category.
Well, coding wise, sometimes they do too.
So massage or any kind of deep tissue work or whatever, do your due diligence. And, I won't say do it just to protect yourself. Do it because it's the right thing to do. It's what your patients expect of you, doctor, with that word doctor in front of your name. And they're coming to you now trying to have their problem solved, but they expect you to be the one to know whether or not you can help them.
I'll segue that a little bit by saying, make sure your associate doctors, your other professionals, and if you employ massage therapists, make sure that they're actually doing something or reporting to you if they're not sure. Because I was recently at my national conference for my massage profession, and I sat in on a risk management class that they had, and they had some case examples, and one of them was a massage therapist employed by a chiropractor, and they didn't. Number one, the massage therapist didn't do their own intake at all, like any kind of intake. It was just get on the table and let me massage you. The chiropractor and the massage therapist did not collaborate or share information at all.
Strike two.
Right. There was an allegation that the massage therapist couldn't even get access to the chiropractic record to help them out. I'm not sure if that's true or not. But I'm saying at the end of the day, standard of care was definitely not, it was breached by this massage therapist, which it wasn't about VAD, but you know what happened? I mean, it's awful. The client lost, they had an amputation below the knee. That was the result of this malpractice case.
Oh my God.
Because the massage therapist didn't take an intake, didn't know they were diabetic, didn't know that there was problems. Let's just put it that way.
Well, this in the old days, I could easily be in a group of chiropractors and hear when you talk about things like vitals and go, well, that's not chiropractic. And that's not what I do. And blah, blah.
Sounds like I'm right there.
Yeah. And the truth of the matter is, whether it was or was not chiropractic then, it is today. We are doctors of chiropractic. Patients expect us to be a doctor of chiropractic, which means that we have to do our doctor things first and our chiropractic things after, assuming that what our doctor things showed us means that it's safe to apply our chiropractic things. So it's a brave new world out there, okay? And it's time for us to just accept the fact that there's been a change with COVID and the vaccines. It's a change. So you take a complete history, you do a thorough exam, you do a thorough report of findings that includes a complete informed consent, and you do the proper treatment based on those three. Say it over and over again.
I have a quote. You probably heard this firsthand from Hippocrates.
He was a good buddy of mine. We used to have coffee every Thursday.
Yeah. He said, declare the past, diagnose the present, and foretell the future.
Exactly. Right? History, exam, report of findings.
There's your documentation standard right there.
Right there. There it is. So, just be aware. Understand that, awareness without action doesn't have any value. So you have to be aware and you have to change. And we hope maybe this impressed you enough to say that if there are things that you're not doing, do them. If there are things that you are doing, I'll give you a pat on the back from long distance.
Doing better.
and just recognize it is a brave new world.
It is. Well, with that, thank you again for joining us for another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini. Thank you all.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.